In today's video, we're going to be talking about whether or not you can reverse type 2 diabetes. Type 2 diabetes is a condition where your blood sugar levels are always elevated. This is a problem because chronically high blood sugar can cause a long list of other side effects, including nerve damage, vision problems, and heart disease. As of 2019, over 450 million people have diabetes worldwide, with over 90% of cases being type 2 diabetes. And that number is expected to reach 700 million by the year 2045. Type 2 diabetes is a serious problem, not only for your health, but also for our healthcare system. More and more people are being diagnosed with diabetes every year, and we are seeing this disease manifest in people who are younger and younger. Type 2 diabetes used to be called adult onset diabetes because it was only seen in adults. That is no longer the case. But why are type 2 diabetes rates skyrocketing? And is there anything we can do about it? Can type 2 diabetes be reversed? Most people who are diagnosed with type 2 diabetes are told that it can only be managed and that the disease is progressive. But the truth is that type 2 diabetes is reversible. When you address the root cause, it is entirely possible to lower your fasting blood sugar. And there are hundreds of studies that support this claim, with participants being able to get off their diabetes medication entirely. So in today's video, we're going to talk about what causes type 2 diabetes and how it can be reversed. Welcome back to my channel. If you're new here, my name's Kate. I'm a health coach and I post videos on a high-fat, nutrient-dense way of eating. If you like this video, please give it a thumbs up, feel free to share, and make sure to subscribe. And make sure to follow me on Instagram, Twitter, and Facebook, where I share new posts every single day. As I said at the start of this video, diabetes, and type 2 diabetes specifically, has become an epidemic. And the reason that type 2 diabetes is such a concern is because the risk of complications and developing other diseases is very high. Type 2 diabetics are at a greater risk of heart disease, liver disease, kidney disease, nerve damage, stroke, and more. If you have type 2 diabetes, it is really important that you address it before it progresses to these other diseases. And if you are pre-diabetic or insulin resistant, you can address it even sooner. So we're going to start off today talking about what causes type 2 diabetes and how to know if you are at risk of developing it if you haven't already, and then we will get into some steps you can take to reverse it. What causes type 2 diabetes? As I mentioned earlier, type 2 diabetes is characterized by high blood sugar. To be diagnosed, you will have to have a fasting blood sugar reading of 7 millimolars per liter or 126 milligrams per deciliter. For reference, a normal reading is below 5.6 millimolars per liter, or 99 milligrams per deciliter. Anything in between is an indicator of pre-diabetes. But what causes blood sugar to rise and stay high? And why do we consider type 2 diabetes to be a progressive disease? There are several reasons why your blood sugar might rise acutely, and this is completely normal. High-intensity exercise, stress, and certain foods can all cause blood sugar to rise. And when blood sugar goes up, our pancreas releases insulin. One of the main roles of insulin is to keep blood sugar within a normal range. So our blood sugar goes up, insulin is released, and the insulin helps to shuttle the excess sugar to our cells, where it is used for energy. Like I said, this is all completely normal. There is nothing wrong with blood sugar rising acutely. But where it starts to become a problem is when blood sugar is constantly being spiked up. When blood sugar is always high, the pancreas is constantly pumping out insulin. And in a healthy individual, the excess insulin is enough to deal with the excess blood sugar. So fasting blood sugar levels remain within the normal range, while insulin is elevated. But here's the thing. Long before you become diabetic, you will become insulin resistant. Insulin resistance precedes type 2 diabetes by, on average, up to 15 years. So diagnosing and addressing insulin resistance can stop it from ever leading to type 2 diabetes. Yes, you heard that right. If you do not address insulin resistance, it will eventually progress to type 2 diabetes. When insulin is high for long periods of time, our cells start to become resistant to it. They start to become less and less responsive to the signals of insulin, which means they're accepting less and less blood sugar. And there comes a point where the cells in our body become so resistant that the excess insulin being pumped out is no longer enough to manage blood sugar. And this is when we will start to see our fasting blood sugar levels elevate, and we will be diagnosed with either prediabetes or type 2 diabetes. So if we know that we are insulin resistant, we can stop it before it ever gets to this point. The problem is that physicians do not routinely check insulin levels. They routinely check blood sugar levels, but as I already mentioned, blood sugar levels can remain normal, even if someone has high insulin and is insulin resistant. Some of the signs of insulin resistance include difficulty losing weight, skin tags, and excess abdominal fat. If you suspect you might be insulin resistant, ask your doctor for a HOMA-IR test. This will test both fasting blood sugar and fasting insulin and let you know if you are insulin resistant. Okay, so this is all great, but what causes blood sugar and insulin to be elevated in the first place? Well, as I already mentioned, several factors can impact our blood sugar levels. But really, the most important one that we need to focus on in the context of reversing type 2 diabetes is the foods we are eating. Our modern diets are loaded with foods that raise blood sugar significantly. The worst offenders are processed food and drinks. These foods are refined sources of carbohydrates, and these raise blood sugar levels significantly and quickly. And we are all eating so frequently. We are constantly snacking on these foods between meals or grabbing a drink from Starbucks. And this means that our blood sugar levels and our insulin never have a chance to come back down to baseline during the day. And when we look at what diabetes medications are designed to do, they are designed to lower blood sugar. So if there were other things you could do besides medication to lower your blood sugar, wouldn't you do them? And that brings us to our final topic for today, and what you probably came to this video for: how to reverse type 2 diabetes. As we have already discussed, the root cause of type 2 diabetes is insulin resistance. When our cells resist insulin, our insulin levels remain high, and this will eventually lead to high blood sugar and type 2 diabetes. So by addressing insulin resistance, you can both prevent and reverse diabetes. But how do you do this? Really, the goal here is to keep blood sugar levels low and stable. By doing this, you reduce the amount of insulin your body needs, and this means both the insulin your body is making as well as any insulin medication. Now, I want to make a quick note here because yes, if you follow the steps I'm about to outline, your need for diabetes medication will reduce significantly. And yes, this is a good thing, but because your need for these medications will reduce so rapidly, if you continue to take them in the same amounts, that could be dangerous. So it is really important that you are working closely with your doctor and adjusting your dosage as needed. In one study done on 28 participants with type 2 diabetes who ate a diet aimed at lowering blood sugar, after 16 weeks, out of the 28 participants, 7 were able to discontinue medication entirely and 10 were able to reduce it. The study concluded, because this diet can be very effective at lowering blood glucose, patients on diabetes medication who use this diet should be under close medical supervision or capable of adjusting their medication. And this leads me to my next point. The foods that raise blood sugar and that raise insulin the most are carbohydrates. Processed carbs are the worst, but even whole food carbs can have a significant blood sugar impact, especially since your body is already not managing blood sugar well. So eating a low-carb diet is extremely effective for lowering blood sugar and reversing type 2 diabetes. And we just saw that outlined in the previously mentioned study. After only 16 weeks, almost 1/3 of participants were able to get off their medication entirely. And these results have been replicated many times. One review paper that looked at 12 randomized control trials wrote, "Dietary carbohydrate restriction reliably reduces high blood glucose, does not require weight loss, although it is still best for weight loss, and leads to the reduction or elimination of medication. It has never shown side effects comparable with those seen in many drugs." If we can keep blood sugar and insulin levels low and stable, our cells will become more sensitive to insulin again. And as the insulin resistance starts to reverse, fasting blood sugar will lower, and the need for blood sugar lowering medication will reduce as well. So the moral of the story is yes, type 2 diabetes can be reversed. And the most effective way to do this, as supported by hundreds of studies, is to reduce carbohydrates in your diet. This can mean eating a low-carb diet or a very low-carb ketogenic diet. If you want to know more about getting started on the keto diet, make sure to check out my Keto for Beginners series that I released last week. Anyways guys, that's all I have for you today. If you did enjoy this video, make sure to give it a thumbs up and comment anything down below. And if you are not already subscribed, make sure to do that. I upload 2 videos a week, mainly on low-carb diets, insulin resistance, sleep, occasionally some vlogs, and some what I eat in a day videos. You won't regret subscribing, I promise. Thank you guys for watching, and if you did enjoy this video, you might also like my video where I looked at studies comparing low-carb diets to low-fat diets in the context of insulin resistance. That video is really interesting. You can check that out right here. If you want to catch up on my most recent upload, you can find it here. And if you want to check out my keto diet and carnivore diet coaching programs, you can find them here. Thanks again, guys. I'll see you next time. Bye.